Assalamualaikum viewers, this is Dr. Aisha Ghias and today I'm going to talk about skin purging. One of my very favorite viewer asked me to make a video on skin purging. Although I've been talking about skin reactions due to most of the skin ingredients that you are actually using in your practice, and I have explained purging many a times in my videos, but let's talk about specifically on skin purging today in this video. So first of all, I would like you to know what skin purging is. Skin purging basically is a skin reaction to any active product that you have used on your skin in the last 1 week or so, which your skin was not used to. By that I mean if you have used something to control your acne or to control your blackheads and whiteheads, or you have used some active products for anti-aging or to reduce the wrinkles on your face, or maybe you have used some product for your melasma treatment or pigmentation treatment. Problems in dermatology do have tendency to cause the skin purging because skin has not adapted to those chemicals, and when you apply in the first place, skin has certain reaction to do. For example, when you apply a retinol compound which is applied at night, for so many reasons, it might be applied to control acne, to control the excessive sebum production, or for the oily skin to control the size or the shrink the size of the pores, and also for the anti-aging purpose. No matter what purpose are you looking for, if you apply retinol on your skin for say 1 week or 2 weeks, the active ingredient, which is a vitamin A derived product, will cause your skin to react in several ways. One of the reaction could be skin dryness, flakiness and redness, a little bit of burning and itching, and it might lead to a temporary breakout of acne that would actually will not be a breakout, but it will fall in the category of purging. So now let me tell you what purging actually is in terms of patient's local language and how far can it last. पेशेंट आमतौर पे अपनी ज़ुबान में ये बयान करते हैं कि हमारी स्किन के ऊपर रिएक्शन आ गया है, हमें दवाई सूट नहीं की है और प्रोबेबली हम इसको दोबारा नहीं लगाएंगे. तो लेट मी टेल यू कि पर्जिंग इज़ नॉट समथिंग दैट इज़ गोइंग टू लास्ट बियॉन्ड 4 वीक्स. इट यूजुअली लास्ट्स फॉर लेस देन 4 वीक्स. 1 महीने के बाद आपको कोई पर्जिंग फील नहीं होती है स्किन के ऊपर. तो इसका बेसिक मैकेनिज्म अगर आप अंडरस्टैंड कर लेते हैं तो प्रॉबेबली यू विल बी पेशेंट थ्रू दिस पीरियड. आप उसमें सब्र करेंगे और 4 वीक्स के टाइम गुजरने के साथ मे बी कि आपको 3 वीक्स या 2 वीक्स में ही ये सेटल हो जाए, बट यू विल बी अ लिटिल मोर पेशेंट वंस यू अंडरस्टैंड द पैथोलॉजी और वंस यू अंडरस्टैंड द मैकेनिज्म. How does purging occur on your face? Basically, the active ingredients, say retinol, decreases the skin turnover time. By that I mean कि normally skin cells जो होते हैं, they take approximately 3 to 4 weeks to get mature to the old cells, then they die up, they leave your skin, they fall off, and then they are replaced by the younger skin cells. And this whole process takes about 3 to 4 weeks, say 28 days. But when you apply these active ingredients like retinol, it decreases the skin cells turnover time from 28 days to say 14 days. So the cells which are going to fall off after 4 weeks, they are going to fall off after 14 days. And the number of cells that are falling off after 14 days, obviously that number also increases. So you visibly find the white spots or the fine powder-like materials on your skin, which is actually exfoliation or peeling off of the dead skin cells from the top of your skin surface. And the same effect is seen when you apply vitamin C products first ever time on your skin, or a product which you are not used to. Maybe the same reaction you tend to see when you're applying products for melasma. So this is skin purging, and the good thing about skin purging is that it's not going to last more than 4 weeks. You have to be a little more patient during this period. करना क्या है? If you have got a skin purging, you need to differentiate it from acne, जिसकी वजह से बहुत ज़्यादा लोग परेशान होते हैं. The patient who has asked me to make a video on purging also believes that skin purging tends to last, but it does not. Skin purging जो है वो last नहीं करती. It's a temporary reaction of the skin. तो अगर आपको ये हो जाता है, what are you supposed to do? You are supposed not to touch your skin. Like बहुत frequently लोगों को आदत होती है कि they just stand in front of the mirror and see, oh my god, this is a new thing that has come up on my face. This is something, a red spot is there which wasn't there yesterday. and so on and so forth. So maybe you're not supposed to touch your skin, you are not supposed to pop up those pimples or the spots that are there that were not there, and then you are not supposed to experiment on your skin some new products that you are not applying in the last 2 to 3 weeks. So this is what you are supposed to do while you have skin purging. Now let's talk about differentiation between purging and acne. If you are already suffering from acne and you think that the acne has got exacerbated, or your skin has been through the process of purging, how are you going to differentiate? Basically, the blackheads and the whiteheads is something which you can see in both the conditions. The irritation and the burning is something which you can see in both the conditions. Pain is somewhat less in purging, but it's more there in the acne skin. In addition, the purging skin is dry and flaky, which is not the case in acne breakouts. In acne breakouts, usually the oil production of the skin actually increases and that leads to breakout. But in purging, the skin goes through the process of drying out and it becomes actually flaky. So that's the point where you can differentiate. And also the classical lesions of acne, moderate to severe acne, which are nodules, and the big lesions are there. But in skin purging, no big lesions of acne are actually seen. As compared to skin purging, which I said is due to applying any new skincare products that your skin wasn't used to, the acne breakouts tend to occur in relation to stress, your dietary imbalances, hormonal irregularities, the clogged pores, or maybe because of the menstrual irregularities. Now, what is doctor recommendation in perspective of skin purging? If you have really got skin purging, it means you are going through a reaction of adjustment of your skin to the active skincare products that we have prescribed. So I would like you to stay patient in this period and do not stop applying this product. However, you can reduce the quantity of the products, or you may even shorten the time duration of the application of the product, but do continue and pass through this time. This is basically an adaptation of skin, and the skin is obviously going to adapt in 2 to 3 to maybe 4 weeks, and you have to be a little more patient and stay calm. You may apply a little bit extra moisturizers, and something very important to follow is a sun care routine. That means you need to apply sunscreens before you go out in the sun, and you need to reapply them after every 3 to 4 hours. The American Academy of Dermatology although recommends the patch testing before starting any active skincare product, but we in our daily practices do not go through patch testing. It's a very tedious, very long process, and patients actually do not tend to understand that. So we tend to advise the chemicals and the products, but we counsel them regarding the possibility of purging reaction or skin reaction. But it's a temporary reaction. Good thing about skin purging is that it's temporary. It's not going to last for more than 4 weeks, and maybe you should continue with your skincare routine that actually has caused purging, but with a little more care, with a little more sun protection routine, moisturizers, and you have to maintain your good hydration of the skin as well on top. So that was all regarding skin purging. Hopefully I answered all your queries that were bothering you about skin purging. If anything else is bothering you people, do let me know so that I can have a proper research on that, and then maybe I will present you with proper facts and figures that stand true for the specific condition. Thank you very much for listening to my videos, and if you find them helpful for yourself, for your family or friends, please do not hesitate to share them. Thank you so much. Allah Hafiz.